Hi, this is Wound Viewer, the first and only 3D wound tracking system based on artificial intelligence. Wound Viewer will be able to improve wound care therapy. Chronic wounds are indeed a huge problem, affecting more than 1% of the whole world population, with 4.1 million patients in Europe and a 40 billion euros burden for European health systems. The over 3,000 physicians specialized in wound care in Europe need to assess and monitor ulcers in order for the patients to heal and not to incur into very serious consequences like the limb amputation. Traditional wound measurement methods usually involve tools like rulers and cotton tips, which are painful and invasive for the patients. On top of that, these methods are inaccurate and time consuming, and the measurement results are usually stored in handwritten paper clinical records that are liable of being lost or misinterpreted during subsequent visits. That's why we invented Wound Viewer, an easy-to-use wound detection, tracking, and reporting system developed with physicians for physicians. Wound Viewer comes with a simple user interface and a high degree of accuracy, and is able to compute all relevant wound parameters in just 40 seconds, while automatically securing clinical data in the cloud. The system is also protected by patent, and we are currently developing the final interface and device, which will be loosely based on our first prototype. Our working prototype has been tested on more than 100 patients and is composed of a camera, a series of LEDs, and a distance sensor. Once the physician has taken the photo, the wound is automatically assessed by an artificial intelligence algorithm. Let's see how this algorithm works. As you can see, the physician retrieves the patient's data. Then, takes a look at the picture, identifies the portion of the picture where the wound is located, and in a couple of seconds obtains all the wound parameters needed to assess the wound. These include the wound surface, its depth, its volume, and the wound granulation. We are currently integrating this algorithm in the final standalone device, as you can see in this mockup of what the final user interface would look like. We hope you liked this sneak peek of Wound Viewer. Thank you for your attention.